Welcome to another episode of Where's My Diagnosis? In this episode, Carrie reveals how critical diagnostic tools like immunohistochemistry were never used. The deeper she digs, the more it looks like the real disease may have been hiding in plain sight.
So, Carrie.
We always laugh, don't we? It's something that's so serious.
Yes, like IHC.
Yeah. So what is...
The cool kids
and
call
is that...
Kev.
So IHC, yeah,
Yes.
that's the
Hashtag IHC.
immunohistochemistry.
Yeah.
What does that mean in your case?
Well, it's a lab technique used to detect specific proteins in cells of a tissue. So it helps determine the origin of cancer. And then if you have two organs affected, which I clearly did, I had the ovary and the appendix. So how did they determine the primary organ, like the primary origin, if they didn't do this testing? And it's like staining. So yeah, there's all these stains that they could have used and didn't. Well, they didn't tell me that they did, and I just only ever had the microscopic and macroscopic findings. So the macroscopic being what the pathologist is looking at, the diseased tissue, what he sees himself, and then the microscopic findings, what he sees under the microscope. So that's all I ever received for anything. Any biopsy ever taken from this body has never received staining. That's been the other. So they basically calling me crazy. That's the common thread. And no staining. Those are the two things I've noticed. Excuse me.
So how did you know that staining was a thing that you need?
Because I only learned that just a few months ago when Kevin and I were going around looking for an oncologist, and I finally had one that we got a referral to. And he said to me that he can't see me unless I can produce the IHC and molecular staining. And I just Googled what's that, and I just applied that to my own diagnosis and my own initial pathology. And I started realizing, hang on a second, if I have a low-grade cancer, why are all these high-grade features mentioned? So that didn't make sense. And then when you have these high-grade features, that's when you use the staining to see, like, what subtype, if there's any mutations, all the things you need to know to have a definitive diagnosis, as well as a prognosis, and as well as your treatment. What type of care? Yeah. This dictates what type of care you then get. Yeah.
Because as you've said previously, the types of scans and blood tests that they were running weren't picking up what you have.
That's right. That's right.
So you kept getting these, your scans, everything's clear, all's fine, but the right tests are not happening.
Yeah.
And no biopsy to then go, well, there's nothing showing up on the scans. Why is that?
Yeah.
Well, if you consider that it could be one of these types of mucinous cancers, then that might be a reason why it's not showing up in the scans.
And then I did the laparoscopies, but then the surgeons are saying there's no evidence of disease inside of you. So I've had and still all these symptoms, but then that's when I started really studying the surgery and my images that I was given. And then,
so what's a surgeon going to think if they don't realize what they're looking at could be things like these mucinous tumors coating organs within your body? Does it look different to a normal inside of somebody, or are they just thinking, oh, this person's got a slightly more whatever gunk it is that covers organs on the inside of your body?
Yeah, they go off of tumor markers, but again, if it often doesn't show up in your tumor markers with this disease, and then they rely on scans, but it doesn't always show up on scans because they have to be a certain millimeter thickness before the scans pick it up, and so you have to have a trained eye, apparently, because some of it can be really subtle.
Yeah. So because we don't have a lot of people that are knowledgeable or expert, at least in this area.
That's right.
In Australia.
Yeah.
they're not going to be looking for or understand it if they saw it. And it's not that obvious that if you did see it, you'd go, wow, that's something serious. You could overlook it without much knowledge.
And for me, I just keep coming back to the symptoms.
That's
You know,
right.
Every time I try to get my head around this whole reality, my mind just goes back to, at the end of the day, regardless of what's showing on tests, you've got a woman who's got a list of symptoms an arm long, you know, like, and we haven't even spoken about half of them on this podcast. But obviously, as close friends, we're very aware of, like today, just breathing is super hard for Carrie.
Yeah.
You know, and so it's like, well, what's the answer, people?
Yeah. So, yeah.
Yeah. So sorry. We were saying there's no staining happening.
Yeah. So when there's no stain, so the appendix tumor needed to be stained, and it had, like I said, it had the high grade features. No more molecular staining was done, and then with the ovary and fallopian tubes and the pelvic surgery, and they sent it to a lab that I just found out recently doesn't even deal with gynecological sampling. So they don't have the proper staining. When you hear PAP, like a PAP smear, that's a stain. So in order for the pathologist to detect cancer cells in your cervix, stuff like that, they use a PAP stain. Over the last 20 years, I'd show up just in the last couple months really sick, and I just demand my stuff. Now I go and I've got a bunch of scans and reports, and I just started teaching myself as best I can how to read. First of all, it was an ultrasound, and it seemed just pretty easy, and I just was able to get the basics of what to look for.
How do you teach yourself how to read an ultrasound?
I look at hundreds of other ones. So I just Google images of ovarian cancer, for instance, and then I just see what it looks like on a scan. And then I look at benign conditions and malignant conditions. So I'll look at, okay, what does endometriosis or an endometrioma, like an ovarian cyst, just a simple cyst, what does that look like on an ultrasound? And what it shouldn't have is color. So when you put you switch the machine to, it's called a Doppler, and that throws off red and blue if there's vascularity, because I don't know if you've heard about a lot of tumors, like aggressive tumors, have their own blood supply. Yeah, so then like it will show up on a scan as blue or red, and some benign conditions will throw off some peripheral color, like so color around the edges that can be benign, but if there's color inside the tumor itself, like where they're measuring, there's a little white box, and then you see this dark mass, and then there's this thing called shadowing. So if you picture an ultrasound, it uses light and waves, and so if you just put a flashlight up, and then you have a solid thing in the ray of the flashlight, you're going to create a shadow underneath that. So it's called shadowing. And it's called shadowing. And so so I saw that over and over and over. And then they have this thing called, it's hypoechoic. So there's dark patches amongst the gray. Have you ever seen, like, your babies, like you see your baby in the ultrasound at the 20-week gestation? Yeah. And it's gray, but you can see the dark images of the baby's thumb, and you know what I mean? Yeah. So, I mean, tumors aren't as cute, but they have their own unique characteristics. And so mine are lobulated. So that's another word I've learned. And benign conditions are usually neatly encapsulated. Yeah. So when you hear, ill-defined borders or margins, that's a cancer sort of thing, because the tumor, because it's so aggressive, it bleeds into the tissue because it's growing, it's anchoring itself into the tissue.
Yeah, it's the same thing with my skin, with the melanomas I've had.
Oh, yeah.
It's the edges that you worry about.
That's right.
If they spread, then that's a problem.
Then you're screwed.
Yeah.
Yeah. So, and then in my reports, some of the 2015 breast reports were saying ill-defined borders, hypoechoic, and still it gave me like a level, I think it's called a BIRADS, like BIRADS, and that it's like level 1 through 4 or 5, I'm not sure. And I think the highest I ever got was a 3. And then I did have another biopsy done on my right breast, or it was my left, I can't remember. And it was, I just remember how painful it was. And they just kept, the doctor just kept saying, oh, I just can't grasp it. It keeps falling apart. And I was like, oh, okay, well, do you want to get there? Because it's really painful. And I was then, told, okay, you'll get your results and your GP will get them. And my GP said, everything's fine.
When was this?
2015, 10 years ago.
Yeah.
And 2006 was the first one that had hypoechoic and it lobulated as well as shadowing and all the red flags for malignancy in 2006.
And remind us what
echoic is when there's, okay, if you see a mass, so if you think about your baby and then there's like the kind of lighter gray area and then the baby's head. Yeah. So if the tumor has a little head, it's going to be darker. So you'll just see this blob and then there'll be another blob and another blob. And so those are darker blobs in the gray background.
Yeah.
That's called hypoechoic.
Yeah.
And then hyperechoic is light blobs. So, and that shows more, I think, fluid and mucin and stuff like that. So I will have light areas inside the dark blobs, but that's showing at the very least a complex cyst. But then when you put the Doppler on it and then it throws out the color that it does, that's an absolute, it's malignant. Yeah. And they keep downplaying it. And they'll say fibroadenoma, but without biopsying. And then I never, again, with the IHC, Kev, no IHC or molecular staining ever conducted to my knowledge. And they won't give it to me. So I'm demanding all of this. Right now, I'm in the process of demanding everything, and nobody is giving me anything.
So what are your next steps now? Well, and what were your, when you first realized that these tests hadn't been done? Other than, go on.
Oh, I just started requesting them and asking questions, but never getting straight answers. And they just give me the runaround. And like, for instance, the expert, I went to Sydney, and I never saw any IHC or molecular staining report. So I demanded that. And he gets back to me and he says, I'm happy to look at any recent scans. And then he tells me that that oncologist that we went to see about 6 weeks ago, that he got hold of him, just letting me know that they talk. And he, again, just said, I'm happy to look at any serums or scans that you have. And that wasn't my question. I said, why didn't you molecularly stain my tumor? No answer. Just like no answer for, are these not mucinous implants in my ovary? You know?
Yeah.
And then no, multiple specialists refused reevaluation. So remember when we were with the colorectal surgeon and he was staring at my diseased images for ages. He wasn't even talking to us. And I thought, oh, great, someone on our side. And he said, you are not going to find any surgeon or doctor who's going to go against 3 other doctors.
Yeah.
Their opinions. So because everyone's cleared me and they said, no evidence of disease, you will not find a doctor who's going to go against that. And I said, even if it's not true?
Well, yeah.
Even if she still has symptoms?
Yeah, that's it. So what are the symptoms? Okay, well, the symptoms now, they keep pointing to your head. It must be all made up. Or you go back to the labels of cancer phobe.
Yeah, or no, I think it's more nefarious than that. Like, I think it's, well, even my trusted psychiatrist of 27 years, she told me that they think I'm a cancer phobe and that the gynecologist told everybody that I have factitious disorder, which she's known me for 27 years, and I have complex PTSD and dissociation, but she's always raved about my intelligence, about my integrity, my dignity, everything like that. And she has always backed me and known that I'm sick and this isn't in my head. And yeah, everything just seemed to.
Well, that was just so astounding to us. You know, again, also we've known you for over 25 years.
Yeah.
And it's plain as day to anyone who knows you well that you're not well. Yeah. I think, well, I'd argue it's plain as day to anyone who spends any time with you.
Yeah.
It doesn't take long.
I know. And how do you, and why, you know, like
Well, there's nothing else about you that's irrational. There's nothing else about you that's not adding up in terms of your ability to comprehend, your capacity to remember and to recall
and
information.
I'm not delusional.
You have a great capacity to reflect. So we've had conversations because I think you're understandably at times just stuck in a space of confusion and frustration and outrage, even though you're not the type to get angry per se, but there's a frustration because people aren't listening. Even worse, people are accusing you of these
being
fictitious disorder,
etc. Yeah, and not taking responsibility or answering any of my logical questions.
That's right. But what I've found is that you're very capable of, when we, for example, might propose a different perspective on something, that you're very open to that.
Oh, for sure.
You know, you self-regulate really well.
Yeah, and I know, like, I definitely have, this has knocked me off. Like, I've had I'm getting sicker and sicker. They're all saying it's in my head when I know it's not, and they're giving me evidence that it's not. And now I have all of the scans that prove that it's not. And so pathology reports that were either vague, falsely benign, are based on incorrect anatomical assumptions, labeling a right side as the left. So that's when I got the PET scan and I saw that my right side lit up in my pelvis, meaning the right ovary, fallopian tube. And then I looked at I looked at the ultrasound that I had before the tumor was even removed. It showed, like I told you, the largest masses I've ever seen. Like one almost looked like a baby. It was huge. This is big, hypoechoic. It was a weird shape. So that would have been the fallopian tube. But the ovary as well was huge. And again, lobulated, hypoechoic, shadowing. And then I looked at hundreds of other ovaries, looked exactly the same as mine. Some not as big as mine, some larger than mine, but mine was an absolute. And then I know people are saying, oh, Chat GPT, but that has been a lifesaver for me because I had 2 years under my belt already of studying, boring study with medical journals and case studies and different reports and different people that I just interviewed and asked them so many questions and saw their pathology and saw they had high-grade features that matched my high-grade features, but I was given a low-grade diagnosis. Nothing made sense. So I started questioning, and then that became really annoying to them. But now they're really annoying to me because I'm getting so sick. And like you said, my breathing in the last few days, it's gotten so bad. So at night, I'm sweating so much, and then I wrap myself in a towel or this like terry cloth gown that I have. I wash every morning. So I soak through that. I get on the other side of the bed, the towel that I'm wrapped in, I soak through that. And then I go to my other bedroom and I get on the bed and I have another towel and I soak through that. And then I just get up. But when I catch like a chill and I can't stop shivering, it's incredibly painful in my neck and back. But what happens is I'm not able to generate enough oxygen to fuel my body trying to warm itself.
Yeah.
And so it feels like I'm drowning and I'm in bed. It's so scary. Yeah.
And that's just one of the symptoms.
Oh, that's just one. And then I find the report with the lung function test that this said psychiatrist kept just throwing in my face recently, saying, but remember, Carrie, you were so anxious that your chest was sore. And I said, yes. And I said, it wasn't like anxiety. I've never had, anxiety where I'd dread bending down to feed my dog because I get a stabbing pain in my chest. And then breathing is just shortness of breath. I'd never had that with anxiety. So I kept saying to her, it's different. And then for her to say, but yes, remember you had that lung function test and it came back clear. And at this point, I was already collecting all the scans that reports had, cleared, and learning that it's anything but clear. It's showing malignancy from 20 years ago. So I don't trust anybody. And so I get my hand on that lung function test, and the part that would show if I was asthmatic or had a pulmonary obstruction, I scored fair and good on. So that wasn't an issue. There was nothing wrong. Like I didn't have asthma or something like that. But where I scored poorly on was the TLCO, I think it's called. And that is indication of something wrong with your lungs' ability to absorb and then filter the exchange of the O2 and stuff like that. And then that's showing up for the last 2 years in my blood. My O2 levels are either terribly low or terribly high, or it's just everything's off. And I again stick my results through ChatGPT, and it says extreme hypoxia. And that's like when you're not getting enough oxygen. And that's what the lung function test showed 3 years ago. So I am constantly being lied to, and now cover-ups are just so obvious. It's terrifying.
Yeah.
So, and obviously what you're talking about is, you mentioned before that 20 years ago, there are tests that were showing things that are problematic. As recent as your 2017-18 MRI of your spine and neck, that is something that you've got concerns around the abnormal findings in that.
Yeah, absolutely. And
so what's that one about?
Well, yeah, then I taught myself to read an MRI. And of course, doctors are going to think, oh, here we go. But this is all I do, as you know.
Well, I was going to mention before that when you were talking, that there was a period there where you kind of went down a rabbit hole of trying to find out information.
Yeah.
But as well as that, you became more and more isolated too, didn't you? Because you became
more and more annoying.
Well, it was, well, you were fixated on.
You guys hung in there. Thanks, guys.
Fixated on trying to
You're worth it.
figure out what the hell is going on.
Yeah.
And a lot of people obviously aren't living your reality, so they found it difficult to either keep up or
be
put
bothered.
Up.
Yeah, put up. That's right. And I get it. It's annoying. And then I am paranoid because how can I not be? I'm finding out everyone's lying to me. Doctors are lying to me. And friends aren't seeming to be able to follow that there's something terribly wrong here when doctors are altering. Did we talk about that Royal Melbourne said that they had performed a right hemicolectomy and I don't
know that we've brought that up, but it's pretty glaringly obvious.
That I do not have a bag, you guys. I mean,
no, we haven't talked about that yet.
I have no shoes to match a bag.
Tell us the story. The listeners are like, what, where are we?
So, okay, when one gets one's appendix out and there's cancer involved, they usually are given a right hemicolectomy, which means they take out a bunch of the right side of your bowel and then connect it back up. But while that's healing, they create a stoma formation, which they pull part of the bowel out and stick a bag over the top and hope for the best, and you poo in a bag.
Yeah.
Yep.
But what you're saying is they said the records show that you had one of those?
Yeah. So if I pull up my online patient portal, it should have said in my surgical history that they removed part of my cecum and my appendix.
Mm-hmm.
And the tumor came out with the appendix. But what it said was they removed my tubes, which they did not. But they said that they performed a right hemicolectomy. And that's, kind of like a fear. I think I'm not the only person on earth who would,
Yeah.
And that's the one thing they did say to me before I went under for the appendix surgery that scared the shit out of me, because it was an emergency and I had to sign the forms and everything. And as they wheeled me in, they went, "Oh, and you might have a bag." And I went, "What? Wait, no, what? Wait, what?" And I started crying, and the anesthetist just put me out. It's terrifying.
Oh my God.
So yeah, I woke up, no bag.
Story is just littered with these moments.
Yeah.
It's like, what do you mean? Like, how can you trust a system that can't even accurately record what did or didn't happen to someone's body?
Yeah.
Like, it's just, it's bizarre.
I know. And trace back to 2005 when my night sweats began, and all they did was a heart echo, and that was it. That was the amount of research or investigation into why a 29-year-old just suddenly develops night sweats. And then it was my psychiatrist who said, "Oh, it'll just be from, your bad dreams and stuff like that."
Now, I'm not convinced that we've finished talking about the 2017-18 MRI of your spine and neck.
No, I keep
showing abnormal findings. There's so much to tell, so we do apologise for going on a meandering tour. But, again, this is just another piece of information where you've gone back and looked at it and gone, what's with that?
And then I saw a 2018 MRI for my spinal part, and that's when I saw the thing in my throat, and I saw these white, so it's called hyperdense holes in my brain, and then just different weird patches in my brain. And I look at other brain MRIs and no, that's not normal. And it can be signs of lesions, and it's clearly there. And then the radiologist for the surgeon, they take screenshots, in the first lump of photos will be just to draw the surgeon's attention to things, because that's their specialty, right? So the surgeon will look at what they need to see, so they don't have to go through everything. And that's how I would teach myself. I would look and I'd see their measurements, and I'd go, well, why aren't the measurements, if they're recording measurements on the screen, why aren't they reporting it? And if they're recording the color Doppler in the ultrasound and there's vascularity, why aren't they reporting it? So I went all the way back, and the MRI, I was with my friend. She was over, and I was looking at these. I had the film, and I was looking. I had it up to my window, and I could see through. And it was annoying because you could see the city in the background, and I was trying to look. And then I saw this big, hyperdense, massive circle on the right-hand side in 2017. It showed ovarian involvement. And the appendix wasn't diseased. So, and then I looked at all the breast scans, and I was just like, oh my God, is there like a mucinous breast cancer? And there is. It's a rare subtype. It's called mucinous invasive lobular carcinoma.
So what did that tell you?
There's this big mass on the right side, and just up from there is the appendix. And it was just a little squiggle. It wasn't diseased yet, which told me the appendix was never the primary tumor.
So join us next time when we are going to continue down this path of really taking a deep dive into what is just not adding up. And clearly that's why we're here. So thank you everyone for listening. To support Carrie on her search for answers, follow her on Instagram and X. Visit her website where you can view the evidence for yourself, which is flyingonbrokenwings.com. We especially invite medical experts to comment on inconsistencies in the various reports and images that we share. If anyone is in a position to support Carrie to...
You can be anonymous. You can be anonymous.
You can. I'm more thinking, you know, if you're a guru out there and you can help us to understand why this incredibly brave herself woman is still experiencing all of the symptoms that she is, then clearly that's the mission that we're on.
Wonder what it could be.
On that note, thanks for listening.